My name is Stefan Burkhardt, and as head of the division South-Southeast Asia, I will be your host today. The HSF is a political foundation and has been involved in international cooperation for more than 40 years now. We are active in around 80 projects in more than 50 countries. We contribute to sustainable development by enhancing peace, democracy, the rule of law, and social market economies. Together with local partners, we implement projects in the areas of political consulting and political education. Today, we are speaking about the Philippines. Second in the series. As we started with China, where the pandemic started, we have now the Philippines, actually the first country which had the first COVID-19 fatality outside of China on the 1st of February 2020, which started with a case by a nurse coming from China. We have now more than 1.1 million cases ranking in Southeast Asia. With Test Bacalla, we have a public voice which will lead us through the dynamics of this pandemic inside the Philippines. How did it start? What have been the reactions by the administration and public? And especially, where are we now and where will we go? So what will be the consequences for the Philippines from a political, economic, and social perspective? Tess Bacalla is an award-winning independent journalist, editor, and media consultant based in the Philippines. She is formerly the executive director of the Southeast Asian Press Alliance and currently the project lead at Asia Democracy Chronicles, spearhead by the Asia Democracy Network. She has edited books for international organizations, including the Economic Research Institute for ASEAN and East Asia, and has participated in projects commissioned by the World Bank and the Asian Development Bank. We could go on here, but to bring it into a nutshell, she is an outstanding journalist. Some technical information beforehand. Please feel free to ask your questions related to the pandemic and the Philippines handling of it through the Q&A box. We will answer as many questions as possible. The discussion will be recorded, but no worries, except of the expert and myself, you won't be part of the recording, whether your name nor your picture. You will have the possibility to rewatch it on our webpage. So with no further delay, I will hand over. Tess, the word is yours.
Good afternoon, everyone. It's my pleasure to be here, taking the lead in this important discussion, and very timely at that. Thank you, everyone, for joining this webinar, focusing on the Philippines and where it is relative to the COVID-19 pandemic. I'll start off by saying that, like many other countries, the Philippines has suffered enormously from the outbreak of the novel coronavirus. From travel bans to community quarantine and one of the world's strictest and longest lockdowns, made possible by enhanced emergency measures, the Philippine government has enforced a series of earnest strategies targeted to contain the COVID-19 pandemic. The consequent and untold impacts of both the health crisis and specific policy measures are partly marked by intensifying economic hardships that we can say became the undoing of a country that had been poised to overtake some of the biggest economies in Asia before the pandemic. Obviously, that's no longer the picture that we're seeing today. I'll share my PowerPoint. Let me just quickly do that. Okay, yeah. So how did it all start in the Philippines? The first confirmed case was detected on January 30 last year, involving a female traveler, from Wuhan, China, via Hong Kong, and together with a male companion who also tested positive for the coronavirus and consequently died on February 1, 2020. Now, the first local transmission involving a 60-year-old Filipino male with no travel history was reported on March 6, 2020. Now, what happened next? The first biggest daily rise in case counts in the Philippines was reported on March 31 last year, when cases spiked to a little over 2,000. Sorry. In early 2020, early part of April last year, the country's fatality rate was logged at 6.6%, eclipsing the global average of 6.4%. By August 2020, the Philippines posted the highest number of cases of COVID cases in Southeast Asia, overtaking Indonesia as it breached the 100,000 mark for the first time. So here's a report. Yeah. And that was very alarming for a country that is relatively smaller in geographical size than Indonesia, with that enormous case count that signaled some alarming signs for the Philippines. Now, so the daily cases peaked in around the middle part of August last year, with a case count of a little less than 7,000. Less than a year later, on March 22, 2021, cases lodged were at 8,000, significantly higher than the previous case counts. It was the highest at the time since the pandemic began. And then that was around the time when experts warned of a second wave happening in the Philippines. Yes. And this was a very clear anecdotal evidence of this was hospitals sort of bursting at the seams, with hospital facilities no longer being able or close to being unable to accommodate COVID patients. Now, just fast forward, in April this year, we had an average of more than 10,400 daily COVID cases, nearly double the caseloads in March, and according to Reuters, and far above the 213 per day in April 2022 and 2,169 in the second half of last year, based on Department of Health Ministry data. Now, what accounted for the surge? Well, for one thing, this was because of the entry of new variants that also affected the Philippines. And then there was the increased mobility in the National Capital Region, otherwise known as Metro Manila, quote unquote, because of attempts by the national government to revive the economy, according to a fellow of this research group called OCTA. So this was very alarming. Just when all Filipinos, of course, were looking forward to the economy opening up, people being able to go back to work, industries being able to operate again, we were confronted with this kind of situation. As you could see from this COVID-19 tracker available on the Department of Health Health website, you could see here, let me just, how the ebb and flow in the case counts of COVID, of COVID patients in the Philippines. Yeah. Next. Now, where are we today? As of May 2 this year, we're no longer at the top of the list in terms of case code in Southeast Asia. Indonesia still has the most number of case counts, but we're next to Indonesia. So, and this is not an encouraging scenario, to say the least. Now, so that's how it all began. What the initial situations were following the confirmation of the initial COVID cases in the Philippines. What has been the response? In mid-March, President Duterte issued a proclamation declaring the situation a national public health emergency. Not long after that, a law was passed called the Bayanihan to Heal as One Act, reinforcing that declaration that we had a public health emergency. Now, a series of measures were set off by that initial action taken by the president. There was the convening of what we call the Interagency Task Force for the Management of Emerging Infectious Diseases. So this is a policy-making body composed of different government departments, in particular the health department, whose secretary also chairs the task force. And IATF is also composed of retired military personnel. The operational arm is called the National Task Force, headed by the Defense Secretary. Okay. So I was talking about the law that was passed not long after the declaration, the proclamation was made by President Duterte. So this law essentially grants the president special powers or emergency powers to deal with this situation. Take note that this was the first national health emergency powers legislated by Congress for the president to exercise emergency power since the adoption of our current constitution, what we call the 1987 constitution. So one of the highlights of that law is the provision for a social amelioration program, essentially in the form of relief packages for the poor, in particular those that are especially vulnerable to this kind of situation, the pandemic. So the government also adopted what it calls a 4-pillar socioeconomic strategy to deal with COVID-19. So Pillar 1 is emergency support for vulnerable groups. Pillar 2, marshalling resources to fight COVID-19. Pillar 3, monetary actions and other financing support to be extended to those that are in need. And of course, there's the economic recovery pillar targeted to create jobs and sustain growth in the Philippines. Now, one of the part of the early response of the government was to impose a community quarantine or lockdown. Now, the initial lockdown, which happened in the Philippines, went on for close to 3 months, severely impacting 75% of the Philippine economy, according to the Asia and Pacific Regional Economic Outlook by the International Monetary Fund. It's significant to note that as much as there were earnest efforts to deal with the pandemic, one of the constant criticisms hurled at the government was a delay in mass testing and poor contact tracing. And this was sort of reinforced by the report I was talking about. So let me quote part of the report. Limited healthcare capacity, including in testing and tracing, may have also affected the effectiveness of lockdowns. Several countries, including the Philippines, ramped up testing and tracing capabilities. But some countries, including the Philippines, lagged behind. Now, it's interesting to note that an estimated 23 million out of the 110 million Philippine population belongs to the vulnerable sector. So they are the hardest hit by the pandemic in terms of loss of jobs, loss of savings, access to vital health services, especially at this time. So these are forms in which they are they bear the brunt of this kind of health crisis. Now, as I mentioned earlier, part of the law, one of the provisions in the law that was passed to deal with the pandemic was the setting up of the social amelioration program, especially for the poor. But according to a private think tank called Ibon, only a total of 14.1 million families received the 2 tranches of the social amelioration program, meaning not everyone of those that needed that were in urgent need of assistance from the government received the support that they were expecting. Now, in terms of impact, the impact of COVID in the Philippines, we've had the worst GDP growth in Southeast Asia as of the first quarter of the year. It's negative 4.2%, and the highest unemployment rate at 8.7%. According to Ibon, the think tank I mentioned earlier, an estimated 3.4 million Filipinos are unemployed as of March this year. This is 1.1 million higher than the corresponding rate before the pandemic hit the Philippines in January 2020. Now, 70.6% of business enterprises from micro to medium were forced to shut down temporarily, but for others, there's no telling when they'll be able to open. But Ibon estimates that the figure could actually be higher. It could be 5.4 million. And then in terms of small businesses and entrepreneurs doing business, more than 200,000 of them had closed shop as a result of the pandemic. Other impacts, of course, as we might expect, incomes are falling with job loss. Incomes are falling. The minimum wage today is 7.2% less than at the start of the Duterte administration, which was in June 2016. Okay. Hunger is growing around 15 million or 62%. That's more than half of the Philippine population of more than 100 million have gone hungry, went hungry in 2020. And who knows whether the number could be higher this year. It's also regrettable to note that relief cash assistance has been significantly reduced under the first phase of this law that I mentioned earlier, Bayanihan to Heal as One Act. The budget allocated for the social amelioration program has been reduced significantly. And even in the 2021 Philippine government budget, down to $385 million. Yeah. Okay. Okay. So just very quickly, where are we in terms of vaccination rate? To date, total doses administered, because it's been said time and again that vaccination is crucial to overcoming the pandemic. At the very least, we need to be able to achieve herd immunity. But where are we? To date, just a little over 1% of the Philippine population has been vaccinated. Our current inoculation rate as of May 16 is 120,000. Now, the target is to achieve herd immunity by the end of the year. To be able to do that, the rate should be more than double the current inoculation rate. And it should be a minimum of 300,000, between 300,000 and 350,000 inoculations per day. But we're not there yet. So yeah, I'm just put the numbers here. So at the current inoculation rate of 30,000, for example, if initially it was 30,000 before it moved up, it will take 19 months to achieve herd immunity in the Philippines. Yeah. Now, there are other issues confronting us in terms of how the government has responded to the pandemic. And I'll read some parts of my report. There were the pre-pandemic structural issues. For example, the low investments being made in public health services. There have been calls for many years to increase the budget for public health, to make public health services more accessible to Filipinos. If we're talking of 23 million that are vulnerable to the pandemic, then it makes sense that accessibility of public health services should be given priority. Then there's the issue of this time and again has been also one of the criticisms hurled at the current administration, the militaristic approach. Throughout last year, in 2020, for example, according to one report, more than 100,000 individuals were arrested for low-level quarantine violations. For example, people going out of their house to buy essentials, but were not wearing masks properly, or who went to another area that's not within their jurisdiction, for example. They were apprehended and made to pay fine, for example, or suffer worse consequences. Police averaged around 1,000 arrests per day nationwide. Just 2 days after curfew was reinstated, for example, the police had arrested close to 6,500 people in Metro Manila alone. I'll show you this picture. Maybe you've heard reports of the setting up of community pantries in the Philippines. Initially, it started with this small community pantry in one of the cities in Metro Manila, Quezon City. Look at the small cart here with few foodstuffs available. It's called Maginhawa Community Pantry, named after the street where this pantry was set up by this young entrepreneur called Ana Patricia Non. Okay, so just using what she could what little savings she had, or what little amount she could muster to be able to set this pantry up. It inspired a lot of people to set up similar pantries across the Philippines. Now, this is a very positive response to the pandemic. But there's another side to it that sort of reflects on how much really has the government done to help the people cope with the pandemic, especially in terms of being able to eat 3 times a day, for example, not going hungry for several hours or days on end. If I remember correctly, more than 6,000 community pantries have been set up across the Philippines, using donations from private individuals and providing vegetable staples, for example, to ensure that people have healthy, eat healthy, for example. So this is a very encouraging response. But this also reflects, to many people, this also reflects negatively on the ability or inability of the government to respond meaningfully to the pandemic, such that the people, the Filipinos, especially the 23 million vulnerable Filipinos, will be able to cope with the pandemic. Now, let me just, I'll stop share for a while, and I'll just, let me read a bit about. I mentioned earlier about some pre-pandemic structural issues confronting the Philippines, and that sort of, somehow informs the kind of impact we're dealing with in relation to the pandemic. The global health crisis has magnified structural problems and manifest inadequacies in public governance across countries. The Philippines is no stranger to this reality. From public health systems to education to lawmaking and enforcement, the pandemic has put a spotlight on fundamental flaws in how the government runs the affairs of the country. At a micro level, the this public think tank called the Philippine Institute for Development Studies pointed out the structural flaws besetting the country, especially dealing with a crisis of grave proportions. Information systems are outdated. For example, when lists were drawn up of people who needed to receive the social amelioration packages, many Filipinos complained, saying, why were we not in the lists when we are extremely poor, just like our neighbors who was able to avail himself of relief assistance? So this is an indication of where our information systems are. This has resulted in unintended delays in data gathering, which in turn could inform decision making. The pandemic has also magnified the inability of the government to provide basic services to its citizens, such as water, which is so vital to maintaining health protocols. How do you wash your hands when you have no access to water? And time and again, we're told, keep washing your hands, constantly wash your hands, because this is one way to avoid getting infected by the coronavirus. The urgent need for access to basic services such as health was also magnified by the pandemic, as healthcare facilities were inundated with COVID-19 patients needing immediate treatment, while others suffering from other ailments were left to fend for themselves, not knowing where and when they could avail themselves of equally urgent medical attention. For example, people needing dialysis. When the priority is to attend to COVID patients, what about those with kidney ailments and who need dialysis? It was also observed, similar findings were observed in 2009, for example, considered the country's social protection program severely inadequate long before the coronavirus scourge reached Philippine shores. They were hobbled by, quote, low coverage and inadequate benefits, poor targeting, and operational constraints due to lack of coordination among program implementers. Fast forward to 2020, with 30% of healthcare facilities without access to clean toilets, sanitation became an even bigger concern among poor Filipinos amid the pandemic. It did not help that 26% of the Philippine population has no access to safe and clean toilets. The sorry state of the country's basic education system was also magnified by the pandemic, namely the inaccessibility of basic education for many poor school children, lack of infrastructure, and poor school performance. The Philippines, says one report, ranked lowest out of 79 countries in the OECD's program for international student assessment in 2018. As digital solutions were adopted by schools, millions of families were caught flat-footed by the shift from on-site to online classes, bereft as these households were of the needed gadgets and the accessibility and costs of internet connection. Poor internet connectivity in many parts of the country, including the metropolis and even more so in remote areas, proved to be yet another major challenge to families already struggling to make ends meet. The inability of parents, many of them uneducated, to assist their children with their lessons while on remote learning was yet another concern voiced by the former. And then there's the militaristic approach I mentioned earlier. Compounding the nation's woes during this health crisis was the overall militaristic approach taken by the government in enforcing emergency measures, notably the lockdown, or what was initially dubbed community quarantine. This led to a raft of reported human rights violations as people were slapped with punitive measures disproportionate to their alleged offenses. Two pieces of legislation provided the basis for this approach, both of which were passed before the pandemic struck. One as far back as 11 years ago, the mandatory reporting of notifiable diseases and health events of public. It's a longish name for a law. But what I'm highlighting here is the Philippines is where it is today, and we're in a sorry state, not just because of how the government has responded to the pandemic, well-intentioned as many measures might have been, but also because we have been hounded by these governance issues that public health advocates, for example, have long been calling the government's attention to, as I mentioned earlier, increased investments in public health. And of course, there's the economic fallout I mentioned earlier. I won't go through this in detail anymore. Now, in conclusion, how has been the Philippines COVID response? And I mentioned in I'll go back to just very quickly to sharing my my presentation. Yeah, sorry. Yeah. Now I pose this question more to get us thinking about where we've been. I put here weighed and found wanting. Vice President Leni Robredo, the Philippine Vice President, who has been, notwithstanding the small budget allocated for her office, has taken measures or embarked on small funded projects to help Filipinos cope with the pandemic. At one point, she had to issue this statement. A crisis of this magnitude calls for a massive strategic response. And this can only be achieved by leadership that is able to pull everyone together towards a single direction. Part of that, quote unquote, part of that strategic response is an evidence-based approach to the pandemic. If a lockdown had to be set up, it had to be backed, for example, by science in terms of how long do we need to have this lockdown so that people do not suffer unduly from the pandemic. I go back to just very quickly before I wind up to to the report that I drafted for Hans Seidel. Part of the challenges also, and this should help inform how we are going to answer the question of, has the Philippines really stepped up to the challenge of dealing with the pandemic? There's the lack of aggressive mass testing, initially dismissed as unrealistic by an infectious disease expert advising the government. The contact tracing in the first 3 months of the outbreak was likewise a fundamental flaw in the government's COVID-19 response. At least this was how many experts viewed it. The ensuing chaos and confusion among the public after the first month of quote-unquote community quarantine was announced also reflected poorly on the government's mitigation strategy and brought an unnecessary burden on the people. Limited health funding, as I mentioned, became all too apparent when government hospitals and frontline government health workers had to appeal for personal protective equipment, worried that their supplies were running out and cases were on a steep rise. In conclusion, various government groups and individuals have time and again sounded the alarm on the Philippine government's policy and enforcement of strategies in reversing the surging tide of coronavirus cases on the domestic front. Such earnest calls have come alongside concrete proposals that, if heeded, may well spell the difference in the kinds of impact that the Filipino public, already heavily burdened by the loss of jobs and other economic opportunities brought on by the pandemic, is yearning for. Allowing, for example, the private sector to play a bigger role in the government strategies will also ensure a more strategic and effective response to the crisis, one public health expert said. But has the government, for example, heeded this warning? To many Filipinos, however, what is far more urgent is addressing the widely perceived failure of leadership that has plunged the nation into its worst crisis yet. And I end on this note. Thank you.
Thanks, Tess, for this input on the Philippines and then the COVID-19 handling of the government and the whole society on the Philippines. Like I said before, of course, our audience is invited to ask questions through the Q&A box. Please write in short and crisp, and we will take them into the discussion. When I would put your input into a nutshell, Tess, and I would probably say that you would argument that the Philippines were not prepared to face a pandemic like this because of the structural problems beforehand already. But of course, then you could ask which country was actually prepared to handle such a crisis, which was not seen beforehand, not in this magnitude. Maybe I will start with 3 topics here. The first topic, which you mentioned several times, were the health topic. You said that already before the pandemic, the health situation in the Philippines was deteriorating. There were a lot of budget cuts already beforehand. And when we look in Germany and around the world, the health sector got a lot of applause and a lot of clapping, but maybe not much more. So are there already, at least now, some provisions into the coming for the next years, which will boost the health sector to cover or to handle better a pandemic like this, if it's ever coming up again, or still we are facing the pandemic? So is there already something in place? Tess, you're muted.
Sorry. Yeah. Sorry, I didn't get the last part. Sorry, could you just
so the question was concerning the health sector, which already had some cut budgets before, and it's now you argumented that the health sector has to be boosted by budget allowances. Is there already something in place which will do that for the next time, or they are still actually not looking at the health sector like they should do?
If this is any indication, for example, this call by this Alliance of Health Workers in the Philippines, which just before the budget was finalized, they were saying that the allocation was just a little less than 3% of the total budget, national budget. This is budget for 2021, and it's still perceived as significantly low considering what we're going through. What does that say about where the government's priorities lie in terms of health expenditure? So that says a lot, and I think that's very telling. Yeah, I don't have the exact figure now, but looking at this report, for example, less than 3% of the national budget. I need to look at the approved budget by Congress. But there's still a lot of concerns being raised by concerned sectors, in terms of the need to ramp up the budget for health. You mentioned earlier, who's prepared for this kind of pandemic? Nobody knew that the pandemic was coming. Nobody knew that like 2 years ago, who would expect that 2 years down the road, we would be dealing with this kind of pandemic? Nobody knew that. But you could see the different impacts, across countries of the pandemic. And that says a lot in terms of the preparedness, not in terms of anticipating what was coming, but in terms of putting priorities where they matter. And that's very important. That is key, especially for a poor country like the Philippines, where people are getting sick left and right. I mean, sick with ailments that otherwise are curable. What does that say about where our government? Of course, we cannot blame everything on the government, but government has public monies that need to be spent wisely, to say the least.
Got you there. You described already the vaccination campaign. On May 3rd, President Duterte got with some publicity his first dose of Sinopharm, a vaccine not approved at this moment by WHO. Afterwards, he apologized to the public actually for receiving this dose, and he announced to send it back to China. Now you already described that the vaccination campaign needs more than 60 months, I think, or 18 months at this rate to have immunity inside the whole population of the Philippines. Actually, how can we see the vaccination campaign on the Philippines? Is it a first come, first serve principle? Is it the vulnerable first? And where are the vaccines coming from? Did the Philippines order enough vaccinations, or so? Maybe you can shed some light on this as well.
There are priority lists that have been made. Priority lists, for example, in terms of who should get vaccinated first, not the ones without comorbidities, but those with comorbidities, for example, senior folk, frontline health workers. So it's set. So that's good. But there have been perceptions, and there's to a significant extent those are valid perceptions, I would say. We didn't act fast enough to obtain vaccines, unlike other countries that moved fast enough. For example, there were negotiations going on between the Foreign Affairs Secretary and the ambassador to the US with Pfizer in the US. So what needed to be done, this is for millions of vaccine doses, Pfizer. But documents were not prepared. And therefore the negotiation didn't materialize. And that's a loss of vaccines that otherwise should have gone to the Philippines that went to Singapore instead. So and the health secretary was being blamed for not preparing the documents needed to finalize the negotiation. Again, what does that say about our capacity to deal with the pandemic? We were close to getting to clinching the deal with Pfizer, because no less than the Foreign Affairs Secretary and the ambassador to the US were involved in the discussions. So that was very positive news until it was reported that, the documents needed were not ready. So, and this explains in part why vaccination rate is low. And vaccination hesitancy, by the way, is quite high. If I remember correctly, and anyone may correct me if I'm wrong, I think 6 out of 10 Filipinos are still hesitant to get vaccinated, especially at the time when there were no reports yet of other vaccines, such as Pfizer, coming into the Philippines. Yeah. So this is also maybe could also be a problem of information. How how is the government communicating with the public to encourage them to get vaccinated? It's one thing to have the vaccines needed. It's quite another to ensure that Filipinos are ready and willing to get vaccinated.
Actually, what I read beforehand is that the Philippines already have a law in place, or they made a law in place, which covers costs if something goes wrong when you get vaccinated. So probably this appeals to that as well, that there's a bit of a mistrust concerning vaccinations as well.
I think you're referring to the indemnity fund law that had to be passed fast enough before, vaccine manufacturers would agree to supply vaccines to the Philippines. So meaning to say, because of what happened before with respect to the, I think the polio vaccines, people were all the more, they had these mistaken notions about getting vaccinated. And therefore, there were liabilities that had to be shouldered, but, they would not, vaccine makers would not want to have to, to carry that liability. But again, this also reflects on some pre-pandemic issues, I would say, to say the least.
Mm-hmm. Maybe next topic, when we go away from the health topic, you said that President Duterte got this emergency powers. First, there actually was the first experience with this emergency powers since 1987. And you mentioned as well that you could sense militaristic approach concerning the whole handling of the pandemic, concerning from the government. And as well, I think in July 2020, the Congress passed an anti-terrorism law, which some journalists made as well in comparison with the pandemic. So when you see all this emergency powers, anti-terrorism law, militaristic approach, what do you think this makes with the democracy in the Philippines? So what are the consequences maybe for democracy in the Philippines? Are there consequences or are there no consequences? How did the public react? How did journalists react as well? And what's the discussion about this?
There's a lot of discussion happening in the Philippines, even last year when the anti-terrorism law was passed, in the middle of a pandemic. Did we need to have that kind of law, and such a law at this kind of, at this time, for example? There was a lot of public outcry, especially from civil society groups, human rights lawyers, other concerned sectors. In fact, there have been a number of petitions filed with the Supreme Court, against that law. COVID-19 and democracy, what's the connection? There's a lot of connection. When you have a government pursuing a militaristic approach that infringes on people's basic rights, instead of ensuring that they have food to eat, that they have access to vital health services. So, when human rights are being compromised, to say the least, in the middle of a pandemic, what does that say about what government's mindset is in curbing the pandemic? Even the United Nations has warned against using the pandemic as a pretext to clamp down on fundamental rights. And there's a glaring reality in the Philippines. People being apprehended for very simple violations, not wearing masks. When poor people cannot even afford to buy a mask, and here you are apprehending them because they're not wearing a mask, and because they don't have money to buy a mask. I'm sorry, but what kind of government do we have when we're in this kind of situation? So, it's regrettable to see these kinds of situations happening. Apart from people, being willing to wake up as early as 3 or 4 a.m. to queue up at the community pantry just to have food on the table, at least for a meal or two, if not for them, maybe for their children. And then they have to deal with, all this, what I mentioned, described as a militaristic approach. So there's a lot of connection between the strategy to deal with the pandemic and its impact on democracy in the Philippines. And the Philippines is a very good case study, I think, to look into it.
Maybe related to this, when I read your article, and I know that in the Philippine surveys are of a big importance, you described that actually that more or less half of the Filipinos expressed their disapproval to the government's handling of the COVID-19 pandemic. But on the same time, another survey said that the administration and the president have still an approval rate of 92%. So how does it fit together?
Yeah, it's hard to, see it's like there's a glaring disconnect between the two. He's still enjoying, he's still popular to go by the opinion polls, but the disapproval of how the government under the Duterte watch is dealing with the pandemic is something else. Maybe I may be wrong. I'm not a political analyst. Maybe people are making a distinction between the president as president and then the government's response to the pandemic. I've not seen the survey questionnaire, so I don't know what underpins, for example, what kinds of questions underpin that kind of question before that particular question was asked. But it's really something to really reflect on, to study why he continues to remain popular, notwithstanding the less than satisfactory, at least in the minds of many, response to the pandemic.
There's a questions from the audience, but I would put it in a broader picture concerning information and fake information. When we look at vaccination as well, I read, for example, that on May 8th, there were 2 million AstraZeneca doses coming from the COVAX facility to the Philippines. Here in Germany, of course, we had a lot of discussions concerning AstraZeneca. And as you know, there were some casualties as well. And then it was advised only to vaccinate people over 60 with AstraZeneca. Here in Germany, some countries around Europe actually stopped AstraZeneca altogether. And there was a question from the audience that maybe it has something to do that the vaccination is coming from China, so that people don't trust the Chinese vaccine. How do you feel about it, and how do you think the government will react to it? Because maybe just one more concerning, for example, if you even see AstraZeneca at the end, of course, it's better to get AstraZeneca as it will definitely hold off the virus. And so, how do you keep up with this information? How do you deal with this in the Philippines?
I think it took a while for some Filipinos, at least, to overcome their, however misplaced, their misapprehensions about Sinovac, which was the first vaccine that became available in the Philippines, in part because China donated Sinovac vaccines. So there's, even before the pandemic, there was already significant distrust among Filipinos in China because of the ongoing situation relating to territorial disputes, the West Philippine Sea. So you would expect that such mistrust would extend to things coming from China, in this case, vaccines. And this also, I think, fueled people's hesitation about getting vaccinated. But once other vaccines, in particular Pfizer, when there were reports that these were coming into the Philippines, I think people started to become more, to overcome their apprehension. So, there's a lot of politics involved also in how people see something as fundamental as the need to get vaccinated, as much as you don't want things like this to get politicized. But that's easier said than done, given that, that heavy baggage that we're carrying on our backs because of our situation. And it's not helped by, pronouncements from our chief executives that favor China, for example, instead of protecting or defending our sovereign rights over the West Philippine Sea, for example. That's an interesting thing to study, because how do these things impact how people perceive, how people welcome or do not welcome, the need to get vaccinated, when this is crucial to achieving herd immunity and overcoming the pandemic. On a very quick note, I would say that many things happening in the Philippines, as in many countries, I would suppose, cannot be separated from what's going on today. So that, having a more nuanced understanding of where we are would require understanding the pre-pandemic issues I was talking about, the otherwise bigger things that we're dealing with, the bigger picture confronting us.
There's another question from the audience. What is the impact of globalization in terms of health and socioeconomic in the Philippines in the time of pandemic? And of course, when you see globalization, then I would widen the question a bit of concerning maybe concerning the tourism sector. So when you look at the Philippines, I think 12% of the GNP coming from the tourism sector, and the tourism sector is probably worldwide one of the sectors which is mostly affected by the pandemic, because everything stopped. Flights stopped, people can't move freely in those countries or in other countries as well. So the question was, what are the impacts of globalization on the socioeconomic and health situation in the Philippines in times of pandemic? And maybe you could add it with a bit of the what does it mean for the Philippines that such a pandemic happened, and especially for the tourism sector, as of course the tourism sector is one part of the globalization and of the possibility to fly everywhere and to go everywhere.
If you're talking of globalization in terms of tourism, for example, because globalization has many facets to it. Yeah. If you're talking of it in terms of tourism, definitely it has had an impact. It's I wouldn't say it's the biggest source of revenue for the Philippines, but it makes up a huge chunk of our economy. A lot of industries, a lot of sectors are reliant on tourism for their income. With this happening, borders have to be closed, for example, travels being restricted. Definitely, it has had an impact on us. But how the government dealt with it again is something else, because as much as tourism was bound to suffer as it did in any other countries, in many other countries, how government dealt with it was something else. Maybe that might have set it apart from other countries that might have, successfully dealt with, this particular aspect of their economy. If travel restrictions were not imposed soon enough, because we were concerned about tourism, the bottom line was we ended up paying more for government not acting soon enough, because concerned about tourism suffering enormously from the pandemic. Definitely it has had an impact on the Philippines, as it has in many other parts of the world. But again, as I mentioned earlier, how the government dealt with it, the specific measures enforced to deal with that particular issue, this aspect of globalization, was something else.
In Germany, we do have a federal system, and the federal system is dealing with the COVID-19 pandemic. Recently, we have seen that the central state to take over more and more regulatory power, as there has been a patchwork of 16 different approaches concerning in Germany. How is it in the Philippines? As I know that in the Philippines, the term of federalism is discussed as well, but not there yet. and or is everything coming from the top, or are there possibilities of a regional level or local level actually to adopt regulations by themselves? And so are there, for example, are there cities maybe who dealt with the pandemic better than other cities, or are there regions which dealt better than other regions because they imposed some strict regulations, or they made better governmental work?
At the outset, I would say we don't. I need to point out we don't have federalism. We don't have federalism. And local government units at the city level, for example, provincial, they enjoy a certain autonomy by law. Okay, but because many of the decisions made in dealing with the pandemic happen at the top, they're bound to implement them. When a lockdown has to be enforced in the national capital region or Metro Manila, local government units don't have any say whether to implement it or not. So a lot of the decisions being made are happening at the top level. And this is where, much of the adverse impacts are coming in. It would have been better if, the autonomy that they're supposed to enjoy by law is really happening and being enforced, in very meaningful ways. Because local government units, cities, for example, Manila, the capital, has made some very good responses to the pandemic. Another city called Pasig City, also within Metro Manila, headed by a very young mayor in his early 30s, is doing very well. If they had more room within which to use their powers, maybe at least within their jurisdictions, there would have been more positive outcomes happening. But because major decisions are happening at the top, they're the only thing left for them to do is to enforce them. And this is, politics, you could say, getting in the way of what otherwise would have been a more favorable response to the pandemic. But I have to highlight that a number of local government units are doing quite well because they are run by progressive-minded local chief executives, to the credit of these mayors, for example, or governors. Some encouraging things are happening. For example, where the community pantry started that I mentioned earlier, because the mayor of that city was very supportive and came to the defense of the what we call the pioneer of the community pantry when she was red tagged, that made a lot of difference. If it happened elsewhere where the mayor is not similarly minded, it would have been a different outcome altogether. Yeah. So we're sort of seeing two pictures here. But again, major decisions are really happening at the top.
Is there something in place, for example, where good policies are getting distributed? So like you said, there was a mayor which actually really performed well. There are mayors maybe then who do the same. Do you think of that, or is it just everybody does it by himself or does by herself and so on?
I wouldn't say. Well, it seems to me that these kinds of local chief executives are still in the minority. But they're inspiring others to do similar things because, they get a lot of very positive feedback from people outside their jurisdictions because of the good governance that they're able to demonstrate. But then, the kinds of decisions they could make should be within the confines of broader decisions being made at the top. So you could say, in one sense, there's only so much that they could do because at the very least, they need to comply with national policies, however sound or unsound they might be.
So last question, as we want to have some hope here concerning the pandemic in the future as well, worldwide as well. Is there a policy field in the Philippines which you think is now better equipped than before the pandemic? So would you say there's something which really where the pandemic gave a boost to this policy field that actually we are now better equipped, we are better in shape, and we can go on from there to give some hope for the future.
To be honest, I'm not too hopeful based on what I'm seeing now. What gives me hope, though, is the kind of inspiration that people were able to draw from the community pantry. Imagine, in less than a month, it grew in huge numbers, more than 6,000 across the Philippines. One small pantry starting in a, otherwise, unknown street in some part of metropolis. So policy-wise, I don't know how this would impact policy, but one thing it signaled to us is that Filipinos are not beyond coming together, standing in solidarity with one another when the government is not able to deliver on its promises. And that to me is very inspiring. And I hope that this will carry us forward as we deal with more crises later on in the future. But policy-wise, the signal we're getting, I'm not sure they inspire hope. But I'm hoping, though, that we are at least drawing lessons from what's happening in the Philippines. Because who's to say whether there's not going to be another COVID-19 later on? But if and when it comes, I just hope we're more prepared, policy-wise, enforcement-wise, etc. I hope that at the very least, we're able to take stock. We're able to pause and reflect on what lessons can we draw from what's going on in the Philippines. Our election is coming up in 2022. Maybe that's one thing to apply, one lesson learned. Who should be our next leader? Who can help ensure that when dealing with a crisis, we will be able to see more meaningful response from the government? So it will have to begin with us, I think.
Okay. Then thanks to Teresa Bacalla for all the answers, for the preparation of the seminar. And of course, thanks to the team behind the scene and of all participants who raised questions or just listened in. The seminar, as I told before, was recorded and it will soon be online. If you have still questions which weren't answered here, please don't hesitate to contact us under asia@hss.de. You may subscribe to our newsletter as well to stay informed for follow seminars and on different social media platforms, Facebook, Twitter, and so on. You will see it when it's ending. Looking already to the next seminar concerning this COVID-19 series, keep in mind on the 9th of June, we will discuss the situation in Mongolia, long under control, but now in 2021, high surging numbers. When you look at the population as well. When you sign out now, please help us to fill out the short survey. It will probably take you a minute so that we can improve our online seminars in the future. And of course, when we talk about COVID-19, please stay healthy and see you in 3 weeks. Thank you very much.